So the question is, to what extent is government on top of this cholera outbreak? And we're joined on the news at 10 by Dr. Godwin Ntadum, the Chief Consultant Epidemiologist, the Federal Ministry of Health. He joins us via Zoom from Abuja. Thank you for joining us on the news at 10, Doctor. I know COVID-19 seems to be taking a chunk of the attention, but with over 10,000 cases nationwide and hundreds of fatalities from cholera, and that's between January and June this year, this is definitely huge. Did this maybe creep up on us?
Well, it has usually been like usually expected. It has been a kind of an annual event in the country. But I must tell you, the country is also trying so much to ensure that this situation does not continue. As we all know, cholera is a disease that is transmitted from waste, fecal-oral in nature. That is, it usually comes as a result of poor sanitation and where you have shortage of water supplies and so. So it comes in a situation where you begin to have shortage of water supplies and other factors. So, like you can see, it has not been as bad as it used to be, but again, it calls for serious concern because some few people are still dying as a result of the disease.
You know, there will always be comparisons, I mean, whether we like it or not, between the response to COVID-19 and the response to cholera, which is clearly affecting those in rural areas much more. So what exactly is being done to curb this?
One thing is a single cholera case calls for attention because it spreads very widely and or very fast also. And because the transmission of cholera is more salient in nature, in that in the community, once it is there, other people get in contact and it begins to spread. The way COVID came, is quite different, and because we are gradually getting used to cholera being part of us, and it is actually bringing that lackadaisical among people, because to prevent cholera, the work lies more with the population than with government. Like I've said earlier, community effort, hygiene, individual effort, all these matters when it comes to cholera.
So essentially now, what do people need to know about preventing this disease? You've referenced shortage of water as one of the major causes, and I mean, we've seen pictures of the kind of water people have to use for their daily upkeep. So what do people need to know about preventing this disease?
Practically, cholera is related to hygiene, water supply, and the way we actually manage our food. We need to prevent flies and many other fomites touching on food. And like I said, primarily the issue is hygiene. How do people live? Where is the source of their water supply? And in an environment where a case of cholera has been detected, it calls for attention. Every other individual in that environment has to protect himself or herself from the disease. Like if you go to some area, packaged water does not follow the usual expected hygiene procedures, and even the bacteria causing cholera can stay up to 2 weeks. So if you somebody who has cholera passes, let's say, some things, I don't want to mention something on the screen, but again, it can remain in fecal products for up to 2 weeks, in water, in swimming pool, and other things. So what we need to do practically is hygiene. And I must tell you that the government is equally doing some things, like in area where there's cholera and there's water supply to the communities, the water resources, the Federal Ministry of Water Resources, State Ministry of Water Resources, they know what to do by ensuring that the water that is passed to the community provided safe. Like chlorination of water is usually a major thing that is done during water scarcity, water supply, and where cholera has been reported. And for individuals, we need to mind where we get our water source, things that can easily keep the bacteria, like ice cream, even in swimming pool, where people swim in an individual with cholera will get in and infect other people. So these are some of the things, but primarily we need to improve our sanitation, hygiene, and also where we live, crowd. All this call for shortage of water, and again, we need to report individuals who is manifesting with symptoms of cholera, which is stooling, watery stooling, like we would describe it, and they need to report in the hospital, and such individuals should be isolated from having contact with other individuals in the environment. And we have at the local government level DSN officer who can get this information and transmit it. All states have state epidemiologists who should be, or who usually be, at the top of the situation once it's reported. One of the challenges we normally have is this goes on in the community without anybody reporting it. Because if it is reported, the role of the state epidemiologist is to quickly trace the individual that is spreading the disease. And once that individual is isolated, the disease will be controlled. Or when the source of the infection is located, the disease will be controlled. But a situation where we don't do all this, we don't report cases until it gets out of hand, it will continue to be a challenge in our population.
Well, Dr. Ntadam, let's round off this conversation in a few seconds by giving us an insight into treatment options and the prospects for recovery, at least give some hope.
Yes, in cholera, the major cause of death is loss of fluid, dehydration. So in individuals who have cholera, what you need to do is to begin to replace the fluid that is being lost. There's oral rehydration, and in most chemists and pharmacies, you can get oral rehydration therapies that are being sold. Then you use it according to prescription. As the individual is passing this through, you are replacing the fluid that is being lost. Right. And if we continue, if we do this, it is not likely that the individual is going to die.
Well, Dr. Godwin Ntadam, the Chief Consultant Epidemiologist, the Federal Ministry of Health, thank you so much for your time on the News at 10.
Thank you. It's always my pleasure.